Good morning, everyone. Welcome to Friday Facts. So excited to talk more with our friend Beth Rosenberg. Connie's going to be doing the discussion today. I'm just here to say good morning and to say some quick reminders and updates. It's Friday, but coming up starting on Monday, May 6th. So you've got a week before this, but please make sure to register for the South Carolina's Coalition for the Care of the Seriously Ill, otherwise known as our sister Serious Illness Coalition in South Carolina, is running their first week-long virtual symposium. It's going to be May 6th through May 10th. So there's Monday will be on veterans and eligibility for hospice benefits. Tuesday will be on compassion fatigue, prevention and self-care. Wednesday, May 8th is legislation and policies. Thursday, May 9th, super important. We are organizing it. We're doing a joint program organized by us here with the North Carolina Serious Illness Coalition. Karen Appert's been working really hard to bring in speakers to talk about the new Medicare codes to support training for family caregivers. And then on Friday, May 10th, it's Advanced Care Planning Conversations, Clinicians and Faith Community Perspectives. Friday, May 10th is also our next Friday Facts. So there's a lot going on that day. So we've got one event starts at 8. Friday Facts will be at 8:30. And with that, I'm going to turn it over to Connie and Beth because I don't want to keep anything. But yes, please introduce yourself in the chat. And please feel free to ask any questions in the chat. And I'll put the registration link for the South Carolina event. Take it away, friends.
Thank you, Heather, and good morning from the Queen City. I'm Connie Bonebreak, and thank you for joining our second Friday Facts in April, which, as you all know, is Healthcare Decisions Month. This morning, I'm really very happy to be in conversation with a fellow Charlottean and active participant, longtime participant in the North Carolina Serious Illness Coalition, Beth Rosenberg. Beth is a licensed clinical social worker, and she has 18 years or more of hospice and palliative care experience. Most of her career, she's practiced in the inpatient setting at Atrium Health's flagship hospital in Charlotte, Carolinas Medical Center, or CMC as we know it. CMC serves as this region's only level 1 trauma center and is an approved transplant center for heart, kidney, pancreas, liver, and it serves as one of North Carolina's 5 academic medical teaching schools. So Beth has had a wide range of experience with patients and families facing serious illness and injury. So welcome, Beth.
Thank you. Thank you.
Thank you for being here. It's my understanding that in late 2021, you joined Atrium's Your Care, Your Choice team.
Yep.
And this team provides education to healthcare system staff and the community, which is what we're all about this morning. So, but before you tell us about that role and your work, we'd love to get to know you and learn how you came to be interested in end-of-life care. Will you please share your story with us?
I will. So, interestingly enough, had you told me my career choice as a social worker would have been doing hospice and palliative 20 years ago, I would have bet you a ton of money that I would not ever want to do that, right? Because it's like, I don't want to talk about end of life. But it's so funny because growing up, I actually came from a family where both sides of the family, no matter how young I was, I don't not remember being in a room where people talked about health. Like I knew from a young age what a tube feeding was and that my grandparents would never want that. And those conversations were a part. We were not told as children to leave the room when people discussed people who were dying or sick. It was always a normal part. But in over 20 years ago, I went to grad school. And the other interesting thing is my focus of education, I wanted to focus on helping geriatric patients and those with HIV/AIDS. And when you think about 20 plus years ago, HIV, certainly it wasn't what it was in the 80s and 90s, but still, it was more of a terminal illness, not like it is today.
Sure.
So But in grad school, and I tell people when I teach classes, I got no education about how to have serious illness conversations. Like it just wasn't part of the program. And I've talked to many social workers from 20 plus years ago, and it wasn't really part of the curriculum, understanding illness or geriatric needs, or those things were certainly embedded, but it's not like we learned how to have those conversations. So lo and behold, I end up working at Huntersville Oaks, and actually Connie was the administrator at the time. And because it's a small world in healthcare, even in a big city. And I met a team with the local hospice that had come in. And I mean, I still get chills thinking about it, but I remember it was literally my first meeting with the family. I worked in the rehab unit, so we had a lot of people coming in that were not going to do well. And we contacted the hospice team, and they were doing palliative as well. And I'll never forget the first conversation we had with a family, and the patient and the family were in there. And, before the meeting, you could just feel the tenseness, what's this conversation's going to be about, and watching that team go through the illness, talk about a person's goals and what was important to them. The energy was just amazing. And people went from this tenseness to being able to breathe. You could literally see them be able to breathe and feel like, oh my gosh, I have control. It didn't take away the emotions of it, but it was just incredible. I mean, I'm getting chills now thinking about it, because I always go back to that. And from that moment on, I was like, it was instant. This is the work I must do. It felt right. And I was shocked. My parents were shocked. What? So, but it makes sense. I was going into a specialty that end of life is part of it, but it just never occurred to me in my head that I would want to be a part of true conversation. So that's my story.
Well, thank you for sharing that. And, it's remarkable how, many years after, you can still remember the feelings in that room. And I'm sure that today you bring those same kind of control, allowing folks to take control of their life decisions. So thank you for that. You know that Governor Cooper declared April as Healthcare Decisions Month in North Carolina, and part of that declaration says that the purpose of Healthcare Decision Month is to raise awareness of the need to provide clear and consistent information to the public about advanced directives, and encourage medical professionals like yourself and lawyers to volunteer their time and effort to improve public knowledge. So thank you, Beth, for doing this today. And tell us about your Care, Your Choice team at Atrium, and what your current role is and what that team is all about.
So as much as I was inpatient for so long doing direct patient care, I've always loved the education piece. That's part of social work advocacy. And so Your Care, Your Choice, I used to help them teach classes a couple of times a year. So I knew about them. And actually my director's here, Michelle Kirby, we used to work together with hospice and palliative care and Charlotte region. And so I remember emailing her, like, because not that I wanted to leave, but I was ready to do education. 20 years of direct patient care, sometimes you just want to move in a different direction. So anyway, I interviewed, and they had a job position, and thankfully they hired me. Thank you, Michelle. And but our team, I love it, because what we do is we want to have patients in the community and team members in the hospital be aligned to learn how to have conversations on both sides about advanced care planning, and to let patients know in the community, we want to also know about your goals and values. That's part of medicine, right? We do a lot of advanced care planning workshops in many venues. We do them in libraries, senior centers, congregate meal sites. If you call us up, we'll just go there. And we do surrounding counties, like I was in Kings Mountain last week. So if you call us up, we will definitely help you guys. So I love that work. I was actually at Levine Cancer Institute yesterday doing an advanced care workshop for patients and their caretakers there. And when we teach those classes, I'll be honest, you can just tell how much people want this information. I mean, the questions they ask are fabulous because they've really been thinking about it, or maybe they hadn't thought about it, but it's eliciting thoughts about what they may want. And the other part that we do, which I also love, is we provide education to staff about how to have serious illness conversation. Again, going back to me thinking, I never want to touch those conversations in grad school. Like my first job, don't want to do it. But I discovered there is a way that we can teach. Not everyone has to be like me and absolutely love it and want to do it every day, but there's a way to teach people to be more comfortable. And that's part of what I love doing. And all of our classes really for staff are about how to have person-centered conversations, which I think most people can do, right? We teach conversations in serious illness, which is through Ariadne Labs to staff. We teach a class through LNEC, which is providing compassionate care. We also teach a class called Navigating Advanced Directives, which really goes through the history of kind of medicine before there was technology in medicine. We talk about the Patient Self-Determination Act, and then we go through the form line by line and make sure that they have time to ask questions. Because most people that have been in healthcare, even for a short time, they don't really even know about the advanced directive and what it means. We teach respecting choices as well. All of our classes, well, the 3 classes I mentioned before, respecting choices, we offer for free to staff. They get contact hours. Respecting choices, we do charge. It is through the company Respecting Choices, so we pay them to have the rights to teach that. Then we also have Guide and Provide Support newsletters, and every other month we even do webinars that are focused on different aspects of advanced care planning, which I love. We brought in a lot of cultural diversity in those webinars to really help people understand different cultures and why different people may make different choices. Even though we have a bias in healthcare, seeing a lot of very difficult experiences and thinking, I would never want that. How do we have the conversation to make sure that we are hearing what is important to the patient, even if it's not our choice? So I love the work we do. It just fills me with so much energy. And, in the 2.5 years, the more and more I teach, the more and more I see that people really want this information. So I'm hoping to broaden it more and more to the hospital, especially.
So are those webinars open to the public, or how would one find out about them?
So our Guide and Provide Support webinars are only Atrium staff. For majority, we do have the ability if other people. Well, let me backtrack. So when you take a class of ours, you are part of our master list, and we send emails out to you about the webinars. So the majority of people who take our classes are Atrium employees. If you take a class and you're not a part of it, you can certainly join. But definitely, I guess if anyone's interested, you could email me and we could certainly see about getting you a part of those, because they're important for anyone to be a part of and understand the different aspects. And it's an informal,
it's
an informal setting. I like the Guide and Provide Support webinars because staff are asking questions throughout it. It's that type of webinar.
Well, and the Atrium employee population is no small number.
No.
So if you can reach all the Atrium employees, you have reached a large population.
Yeah.
You shared with me a little bit about some unique cultural nuances from Hmong families that you have worked with.
Yeah.
Maybe tell us more about that. And are there other unique insights about advanced care planning that maybe are often omitted when this topic is discussed that you have come across through your years? I
mean, cultural diversity certainly is a very big part of this. Actually, before we went on live, I'm Jewish. I grew up Reformed, But even in my faith, right, there's so many people who practice differently. And I teach people, definitely it's good to understand a background of a culture, because the first time I met a Hmong family, I didn't even really know about them. I knew they were from Vietnam, but they are a different culture within that country, right? And thankfully, because of grad school, I had the tools already to be comfortable to ask questions. You know, sometimes people, and I don't know, I think it depends on how you're raised. It's like, don't be nosy, don't be asking people questions about their life. But, you know, I have tools that I feel comfortable asking cultural questions to help understand that person. And certainly letting them know always, anyone I work with, if you don't want to answer a question, that's also fine. I want to get to know you and what's important to you. That is why I'm asking them. But I've always loved the diversity piece. And, you know, I would say 20 years ago when I started working in Charlotte, it wasn't as diverse. I mean, it has changed so much, which I absolutely love because I love learning. So that piece, and I, you know, it's hard to specifically talk about any culture. There are a lot of tools I don't know if people are aware of, but there's so many tools out there that you can literally in a short period of time ask some very neutral, culturally appropriate questions. You know, how does your family talk about illness? That really says a lot. Even if you are from America, right? Different people in different states with different faiths handle it different ways, right? So there's just so many tools about that. And what was the other question? Because I forgot it.
Just are there some unique insights that maybe get omitted when we're talking about this topic that you want to share?
So one of the things that I love to share when I teach just about the healthcare power of attorney and living will, so many people feel like the healthcare power, I find so many people feel like the healthcare power of attorney is attached to the living will, like they're one and the same, and they are not. So when I teach this class, knowing that when you're 18, you really need to have one, and knowing that every state has a decision-making statute about who we are going to call in the event that you can't make decisions for yourself, right? You know, many of us know probably someone who does not have the best relationship with the family that raised them, right? Things happen. People don't necessarily feel safe having their immediate family make decisions for them or even know about their health issues. Hence, just having HIV/AIDS, you may have the best relationship with your family, but want to hide that piece, right? So I tell people all the time, one of the most important things about the healthcare power of attorney is letting one or two people know what your health issues are. What about just your medicines you're on or allergies to meds? Like in medicine, we need to know those things because taking medicine that you may not be able to handle because you're allergic to could cause complications. Even food allergies, you may be confused and cannot talk, and you can eat. But what if we give you something you're allergic to? Again, if you're going to the hospital because you need care, we want to give the safest care. So I tell people when I do the workshops and even staff education, when you have a healthcare power of attorney, give them a folder with your medical information so they have it, so that along with the healthcare power of attorney and if you do the living will, you have it so that you get the safest care. It's so important. You know, the living will is a piece that people, I think, assume if you, and most of you probably who are a part of the coalition already know this, but, you know, they think, oh, you're going to look at the living will and there's no conversation at all. It says, I don't want to be on a vent. And it's like, no, we will never look at that until you meet a criteria. And even then we're going to talk about it, right? So I love educating people about the things that are assumed about the directives and make them feel like it's safe, and it helps me have control as opposed to taking away control, because that's what we find. You know, people like, if I do this, then all my choices are out the window. Or I can't even change my mind because in North Carolina, you have to have it notarized with witnesses, which make it more, I think, for many people, why do I have to have it notarized, right? It's almost that suspicion of, is this much more of a legal thing than I could ever imagine, right? To have, can I have the ability to change it? So, but yeah, I like to normalize it for people so that they feel like, okay, this is something I can do no matter what age or where I am with health, the healthiest I'll ever be or seriously ill. And I tell people too, because I told people this yesterday, have a dinner party, take these documents and make copies and have a dinner party, right? Or have a picnic, whatever. Have everyone talk about it at once. You know, it's so important that we normalize the conversations.
Talk to us a little bit about the family involvement or friends and family involvement in advanced care planning. You mentioned that to me the other day about sometimes we talk just about the patient and not so much about the family. So,
right.
What would you say?
I totally respect a patient if they don't want their family involved in conversations, especially at first. A lot of times people need a neutral person to talk to and talk through their wishes before they talk to their family. Because those of you who've done direct patient care, sometimes families will interrupt and be, oh, but you have to do this, or you can't do this, or, you know, no, they elicit their wishes on the patient, right? And it's very difficult because then the patient's in flux about what to do. But I also really think it's important that we have someone that we feel safe to hear what's going on so that we can have an open dialogue, and that there is no feeling of judgment, that I'm really trying to weigh the options. Just like all events in life that are difficult, we want someone to weigh what's going on and not to have, and just have that neutral field. You know, I am, because of a lot of things I've seen in my career where I find that people are suffering because I see they're going through treatments, it's difficult for us to see. But I just read an article a couple weeks ago I shared with Connie that was this most beautiful story, but it really, as you were reading it, it sounded like, oh my goodness. And there was this woman who had end-stage cancer. She had been going through treatments for, she had had a relapse. So she had already had chemo, radiation, and it came back a number of years later. And the oncologist had told her, we can do some treatments. It could give you a few more weeks or a month or two, but the treatments are pretty significant. You would have worse side effects than you'd had before. And at first she chose not to have the treatment. And in this article, the resident who wrote it was speaking about how we need to have more person-centered conversations to really understand why people make choices and learn how to have those conversations. And ultimately, the woman came back to a doctor's appointment and said, no, I've chosen to have the treatment. So as she's going through the treatments, the resident was with the patient in one of the follow-up visits. And she said, you know, she was asking questions, you know, I'm just curious about, you know, why. It's fine that you changed your mind, but you're going through a lot of difficult symptoms and are very uncomfortable. And you had told us originally you didn't want to have that. And she said, you know, I talked to my children and they really, really wanted me to have this treatment. And the suffering I'm going through is worth it because I'm helping my children be able to cope with it. And that is my gift to them. And we always think about, you know, and it was a new mind-opening thing for me as a social worker, that we may not agree with people's choices because we've seen suffering, but for her, that suffering was a gift. But how do we know that unless we know how to have open conversations where we ask these questions to help them find what's best for them, even though I don't know if I would make that choice. That's okay. It's her choice. So I always love that I think I know things and then boom, woo, there's another way to do it. And that's another part of the work we do, right?
Absolutely. The older I get, the less I know is what I have come to believe. So
yeah.
Thank you for sharing that story. You know, Beth, you've been involved in the coalition much longer than I have, and thank you for that. Is there a message that today that you would want to specifically leave with coalition members who are listening this morning or who may call in later? What message would you want us to hear?
Well, I just think that if we, a part of the coalition, if we who do this work can actually do it for ourselves and our family, starting that, normalizing it, and that's not to say that you have to complete directives, but begin the conversation, right? Because we'd never do these workshops in the community and say, you must complete it. We say, look, the conversation is the most important. If you want to do the document, do it. But talking about it, letting people understand, if we can do it, then we can broaden that, and then it just kind of waves out into the community. I think that's the important thing, because it normalizes it, right? I think after so many years that I've done this, and even the coalition, when I'm in part of the community advocacy and education group, and we'll talk about it, like we know that doing this can be difficult, but the benefits are great, and the benefits really help us all, right? As a community, as healthcare providers, as those, whatever we do, because death is something that we don't talk about, but it's going to happen to all of us. So, and as much as I don't want to die, right? I'm less scared about it because it's out in the open. I've ripped the Band-Aid, right? I've ripped the ability to let it carry the fear that it had on me, right? And I just think that is such an important piece, right? I'm hoping I'm 100, but we don't know when it's going to happen. So
That's right.
I think that's so good. So if we can do it ourselves, then, we can help others, and because they'll feel more comfortable, and then they'll do it, and that ripple effect will just happen.
Thank you so much. If anyone has a question, please put it in the chat. As I'm looking at the chat, a couple of things stand out. One, two people talked about the book, The Spirit Catches You and You Fall Down, which I also have read. Fascinating book and horrifying story about a Hmong family. So
Wow.
we commend that book to you, and it's in the link is in the chat. And then your boss, Michelle, says, we're so glad to have Beth as a part of our team. Her passion for this work comes through in every conversation, and it's certainly come through in this conversation today. So thank you for being part of the coalition. Thank you for bringing passion to every interaction that you have with our neighbors in and around Charlotte. Does anybody else have a question for Beth before we wrap up this morning? Feel free to come off mute or put it in the chat.
Well, I just want to say amazing. And it got me thinking about, as a coalition, you're doing all kinds of great education. We heard from the ECU at the monthly meeting. I was at a Veterans Caregiver Resource event yesterday in AARP 2 days ago, and it made me think, one of the neat things I think we all could do is work together and start to list out all the different places that I know our trellis friends are doing it. So many of us are going around the state doing education that's open to the public. And so maybe that's another thing we could do as a coalition, is start to keep sort of a master list of where things are happening throughout North Carolina. Because I'm inspired by everyone else doing it. And I have notary supplies. I'm happy to come to any of your events. So I'm inspired. Thank you.
Thanks. Yeah, this has been great to talk to you guys too. Thank y'all for letting me share my story, because we all have stories, right, that help us all get through all this work.
Well, I am grateful that our paths have crossed again, Beth.
Yes.
And we're older and wiser than the last time. So you have continued to have great success. Thank you, Heather, for letting me be a part of this morning's episode.